This video is to describe what you might expect during an evaluation for an orthopedic condition. At Breaking Through, we work with orthopedic and neurological conditions. So for orthopedics, we're looking at sports injuries. It could be an activity that you were doing out in the yard or over the weekend of pain. You might have injured your knee, your hip, your back, or something you've been dealing with for quite a while. In any case, what we're going to do is we're going to bring you in and talk to you a little bit about what's going on and some of the things in your history. What makes it really efficient is you're able to fill out some of this documentation ahead of time so that we can get right down to business and get going to really find out what's going on. What we want to do as physical therapists is find out what is the root cause of what you're dealing with. So in order to do that, we've got to kind of dig a little bit deeper and see how you're moving so that we can really decide what is it that's causing your pain. And we don't like to stop at just what the pain is and try to cover it up with a bunch of different types of treatments so that you feel better, but we don't really impact the initial issue. So we're going to dig a little bit and have you initially go through a series of movements, and we're going to observe those to really see how are you moving, what does your range of motion look like, and what things are you kind of avoiding. So as we do that, we are able to see this is the area that we need to focus on, and it's giving us clues towards our investigation during the assessment once we have you lay down on our plinth table and do some treatment there. So after that series of movements, which is what we do as our pre-screen, we have you lay down on our plinth table, and we're going to take you through a series of assessments for each individual muscle. We're able to treat from the bottom of your foot right up to the base of your skull. And that way we really get a strong indication of what is it that's working and what isn't working that's impacting the instability you might be feeling or the pain that you're having. So after that screen, you've got a pretty good idea of how you're moving, and you're able to see it too. Then we have you on the table, and we're going to test those muscles and see how do they respond, how do they respond to that resistance, and if there's pain, if there's limitations, if you're just not able to go very far into the range. As we're doing that, we're treating each one of the muscles that do not pass that test, and then we're going to retest it quickly following to see that function and strength and ability to fire has been restored. So as we progress through that, you're going to feel more control around each one of the joints, and then we're going to get you back up off the table and go through that screening process again, have you go through each one of those movements so that you can see and we can see this is what is improved and this is what might need a little bit of work. Following that, then we're going to start to teach you and prescribe some exercises that we want you to do. It's not an extensive list of things. Well, our intent is try to keep that between 5 and 10 minutes that you're able to do, because if it's something that is doable and easy to complete, then you'll actually do it. And it's super important for you to be able to do that, because that's how you're now going to be treating yourself. We are very adamant about trying to educate you so that you know exactly what you need to do to treat your body, to keep your success moving forward and get you back to doing what you really need to do. So you're going to be asked to perform these exercises, which again, they take between 5 and 10 minutes. We're going to ask you to do those several times throughout the day until we get to our next appointment. And the goal of that is to keep those muscles working. We're also going to ask you to get back into the activity as much as you can tolerate that you like to do. So we don't really believe in a lot of rest unless it's absolutely required, but we want you moving and being active and being able to do the things that you need to do. At the end of our session, we're going to work on scheduling you to come back in within 3 to 4 days, because we feel like that's an adequate time to be able to see what's going on following our assessment and how successful that home program is. The second session is really probably the most important session that we can have, because that tells us all that information. How did you respond, and how's your exercise program going? At that point, we're going to do a lot of the same stuff. We're going to have that screening process. We're going to be assessing each one of the muscles again and treating those, and possibly going into even more depth and really determining what else is it that you need to keep moving forward. And then we're going to go over your home program and check on that, either re-educate or add some new things to make sure that it is a personalized program that's just for you and keeps you moving forward. Following your sessions, you might experience a little bit of soreness, and we look at that as a good thing, because some of those muscles, especially if you've been dealing with this for a while, they haven't been working for that length of time. So now we're getting them active, and we're putting you through a series of movements. So there is going to be some soreness, and we look at that as a good thing, because now you're starting to restore that function and you're starting to feel better and move more. So soreness, we look at as a good thing. You're also probably going to see that your movement is getting better and it's easier for you to move, and your pain should start to be coming down. A lot of our clients report a significant decrease in pain, but it doesn't all go away every single time. Sometimes it does, sometimes it doesn't, but we don't like to chase that pain, because we are really treating the root problem, and then as that root problem is improved, pain starts to decrease too. So you're going to experience all those different things, but the one question we get is, I'm feeling sore, is that okay? And we think yes, because that's a good indication that we're going in the right direction. So that first session lasts anywhere between 45 minutes and an hour, and then we get you back on your way to do the things that you need to do, and that pretty much covers what that first session looks like. So I hope this helps you to better understand what it looks like at your first session at Breaking Through. Takes away any questions or concerns that you might have, so we can get you in here. We can start to help you really understand the problem that you're dealing with as we understand it ourselves, and then teach you on how you're able to combat it, to move forward, and really improve. So please reach out if you have any questions. We'd love to be able to talk with you and figure out how can we get you in here to really move forward and get you back to doing the things that you love to do. So, all right, hope this helps.